Welcome to the Rotary Time Show, a public service program presented by Rotary District 7610. On our programs, we talk with Rotarians and community leaders and discuss how Rotary International builds partnerships to support local, national, and world communities. I am your host, Rotarian Dr. Deborah Jackson from the Rotary Club of McLean, Virginia. Project Ahead is a 501c3 tax-exempt organization established in 1981 with the mission of working with underserved communities in developing countries to reduce and eliminate disease and premature death, to cultivate and advance healthy living, and foster sustainable environmental activities. Joining me remotely is Dr. Les Kingslow from Project Ahead. Welcome, Dr. Kingslow, to the Rotary Time Show.
Thank you, Dr. Jackson, for having me, and I'd like to thank Rotary International for inviting me to this forum.
Oh, it's our pleasure. We love it when we're able to bring individuals onto the show that can share some of the work that many of our leaders in our communities are doing here and abroad to impact this great world that we live in. So let's get started. I want my listening audience or viewing audience as well to hear about you. So tell us a little bit about your background and who you are.
Well, I'm a third-generation physician. I hail from New Jersey. My grandfather was a physician trained at Meharry Medical College in Nashville. My father, the same, at Meharry. I trained at Howard University Hospital, where I did medical school. I did my residency at Virginia Commonwealth University in internal medicine, and I did my pulmonary and critical care fellowship at George Washington University and the National Institutes of Health. I currently function as a private practicing pulmonologist in the greater Washington area, and I have some affiliate practices in different communities, one in the U.S. Virgin Islands in St. Thomas, and a second one at Mass General Martha's Vineyard.
Okay, so you really do get out and about and around the world.
I sure do.
This is all good.
Interestingly, my not only is my family a host of physicians, but my wife's family are also physicians. My wife is an obstetrician, gynecologist. Her father and brother are both pediatricians, and her sister a dentist.
Okay.
Mm-hmm.
That explains a lot about what we hear a lot about Project Ahead, that was a family mission. So I'm excited to hear us get there. So talk to us. What is Project Ahead?
Well, it's Ahead Incorporated. Ahead is an acronym for Adventures in Health, Education, and Agricultural Development. It was founded, as you said, in 1981 by Dr. Irving and his wife Elvira Williams. Their interest in developing, doing developmental work in Tanzania began from his intention of taking his children abroad for an adventure in a developing country. And while there, he recognized the sheer deprivation of healthcare, particularly in the pediatric population, and made a commitment, a lifelong commitment, to help to try to eradicate disease, improve outcomes, reduce premature death by working with marginalized and underdeveloped communities to try to improve outcomes in those communities. So they came back to the States and came up with this concept of trying to do healthcare delivery. And since then, they've been returning to Tanzania for the last 40 years.
Wow, that's pretty impressive. How did they decide on the objectives and the particular goals for this project?
Well, they recognize that health is a multi-pronged approach. If we are able to cure the disease, but we don't provide a foundation where the individual and the family can foster, then we're only resolving or partially resolving one of the many problems. So they took a multi-pronged approach. In addressing the healthcare needs, they recognized that they also had to address other forms of healthy living, agriculture, education, economic development, hence the acronym Adventures in Health, Education, and Agricultural Development.
Absolutely wonderful. Give us from its beginnings, maybe a successful outcome that you've had so far and the factors that have contributed to that success.
Sure. One of the earlier projects in the early 2000s was our efforts in vaccinating communities, and we were invited. We don't go into communities without being invited, first off, and we were invited into a rural community called Shinyanga, where upon our entry into the community, approximately 2% of of the pediatric population were receiving vaccinations. Hence, children were dying from conventional diseases that we no longer see here in the United States: measles, mumps, rubella, typhoid, uh, tetanus, of all things. And with the partnership with the NGOs on the ground, the principals in the community, and the grassroots workers in that community, we were able to move the vaccination rates from single digit to 98% within a 2-year time frame. And that was phenomenal. It was recognized both within the country and internationally as a breakthrough accomplishment. And in turn, it saved hundreds, if not thousands, of lives.
Absolutely. What an impact. It was truly an impact. And thinking along those same lines, the program, how do you maintain the culture and the respect of the communities that you serve? Because we're very different how we operate here as opposed to when we go into these other communities.
So, great question. I think the fact that Dr. and Mrs. Williams and their children actually lived and worked in Tanzania for 3 years before returning to the United States, it forged an ability to not only learn the language, but also learn aspects of the culture, be able to communicate, be able to be sensitive to the cultural norms and sensitivities that specific communities might have. And then with that, the concept that we're not interlopers or colonists, but we are actually coming into communities to literally partner with those people on the ground to forge programming that's going to improve the quality of life in those communities, but also be reliable and sustainable for years and years to come.
Wow. So what metrics do you use to track the progress to ensure that you are moving in the right direction and you are making a difference?
So we initiate our conceptualization hand in hand with the local community and the local health district. Then we do training and implementation, and then we do post implementation evaluation. So we will come in after the program. We have folks that are literally on the ground that we meet with serially. We collect data, we review that data, we find pitfalls, and then advance along those lines to improve the programming moving forward. And we stay in communities not for a year or a couple of years. Usually we're there for a minimum of 3 to 5 years before we are invited to move on to other communities within the region.
Oh, that's I love it. You probably need a lot of volunteers if you're there for 3 to 5 years to ensure that the work gets done, because it sounds very complex. So it will take that. How do you select the staff, that participates in your program? Are there specific qualities that you're looking for them to have in order to, because remember now we were just talking about you have to be sensitive to the communities that you're entering.
So we take everybody, interestingly enough. We've had volunteers from all across the globe, from Europe, from the continent of Africa, from the Caribbean, a sizable segment of volunteers from Bermuda, and here in the United States, obviously. And we've had over 500 volunteers since our inception. We do trip training. Typically, we do a mission every year, and usually it's in the summer months. Sometimes we'll go during the winter months to do some advanced work. And then we have people actually on the ground that are volunteering throughout the year in country that are typically indigenous people to the community. As far as training, we do in-services in advance of our arrival in country. And then once we're in country, we also do in-services once we get into Dar es Salaam. And then when we get out to the community, we do an in-service there in advance of us commencing the projects.
Wonderful. So that means I can go.
Of course. Oh, you're more than welcome to go and bring your entire family.
Yeah, you mentioned it. It's a family initiative, so that's doable. You know,
my children have been going on.
I was going to ask you that. Yeah,
since they were 5 years old. So yeah, it's a family initiative.
What would they say if I asked them what's one or two words or three words that would describe their experience? What might they say?
Good question. I think that they would say that they consider themselves world citizens.
Okay.
Because of this experience.
Yeah, absolutely. And how nice. I remember saying to someone in education, because that's my field, that I think every educator should do some work, you know, in another country and then come back into our schools, because you would approach it very differently. So
right.
I hear you. What are some potential challenges or obstacles that your program has faced, and how did you address it?
So, as you can imagine, the communities that we go into are very, very rural. And if you had to make a parallel here in the United States, I don't think there is one. I often say to folks, have you ever been in the Mississippi Delta or in the Central Ward of Newark, New Jersey, or the Bronx, where healthcare access is sparse and very marginalized? And if you could imagine that and then put that on steroids or exponentiate it multifold, then you'll have a sense of appreciation as to the pitfalls and challenges that the head faces when we enter into some of these rural communities. The key to our success is partnership with the community itself. And we recognize that the resilience of the human capacity forges success. Where we find our greatest challenges is that capital is needed to build capacity and infrastructure. Yes. And that's where we face our greatest challenge.
Wow. Well, we're going to come back and hear more about your organization and the kinds of things that you are doing. We are going to head into a break. We'll be right back and talk more with Dr. Les Kingslow. Please stay with us.
We are this close.
We're this close.
We are this close.
Of uncertainty.
To making history.
This close to changing the world.
We're this close.
This close. This close to making sure no child suffers a crippling disease
ever again.
This close.
We are this close to ending polio.
Ending polio. All we need is you.
This close.
If we don't act now, we may lose this chance forever. Help Rotary make history at endpolionow.org.
Welcome back to the Rotary Times. We're here talking with Dr. Les Kingslow with Project Ahead, Inc. Doc, it's been such a delight hearing you talk about the program and the kinds of things that you're doing in Tanzania to impact the culture, the kids, the families. You know, my heart is always with kids, so anytime somebody's doing something with kids, I'm right there. So this has just been wonderful to hear. So let's talk a little bit more about your collaborations that you have with other Rotary clubs or local organizations or government entities that you've worked with to ensure that the program itself is aligned with the initiatives and priorities of the area that you're working within.
As you can imagine, given our 40 years of active involvement on the ground in Tanzania, we've partnered with a variety of entities, both international as well as U.S. based and in other countries as well. Some of those include the obviously the health department, the Ministry of Health in Tanzania. We've had international grants, national grants, including PEPFAR, the Family Values Foundation. We've partnered with a number of medical schools, including Howard University Medical School, University of Maryland Medical School. And we've had grants from larger foundations like General Electric, few others that I can't remember off the top, but as it stands, we are in direct contact with one of your sister chapters, the Rotarians of Bukoba, Tanzania. And our interest in partnering with them has been because they've already committed to a project that's similar to what we're interested in doing. And that is providing solar energy for a healthcare center that we developed and funded that's in their neighboring community of Maruku, Tanzania. The health center was a public-private partnership with AHEAD and the district government, as well as the health department. And it was literally a grassroots project where the community literally came out and brick by brick built this hospital with the assistance of our funding. The hospital was opened in 2019, and since then the facility has flourished in that their capacity has increased, their numbers of patients that they've seen have increased, and as recently as August of this summer, we were able to open up their operating room. Okay. They have since done about 25 surgeries successfully, whereas prior to that, all patients who required surgery would have to travel to the district hospital, which was about 10 miles away.
Right. Well, one of the good things that you just mentioned a little bit ago was Rotary now has a new focus area, an additional, I should say, focus area, and that's environment and the climate. And you just mentioned a wonderful area that Rotary also is getting involved in. And to hear you talk about solar energy, it's going to make a huge impact, I suspect, on what you're doing there, especially with the hospital.
Yeah, we recognize that it's an international crisis as it pertains to access to energy. Here in the developing countries, we have liberal access to electricity to the extent where we take it for granted. But in communities where energy is sparse and limited, it influences every aspect of living, whether it be healthcare and food preparation to economic development, as well as the climate and the environment. So our hope is that with the Maruku Health Center that we can provide them ample access to sustainable and reliable solar voltaic energy.
And you talk about sustainability. How do you ensure that you will have this long-term impact, on that community?
Well, we have a AHEAD Tanzania chapter that actually is based in Maruku, the community where the hospital is. So that partnership has been long-standing and is continuing to flourish. With that partnership, we've been already able to implement infrastructure improvements, not only with the healthcare system itself, but departmentally within the hospital. As I mentioned, we opened up the operating room just this past summer. We devised and developed a dental clinic a few summers ago, and we're improving capacity there. This past summer, we did a 2-day health fair where with the presence of 3 physicians, 3 nurse practitioners, and about 13 volunteer nurses here from the United States, we were able to see over 700 patients in 2 days, which is rather phenomenal. And those patients were then triaged into the healthcare system there at Maruku or on to the district government for further more advanced care. So there is an effort, an intention, and the capacity to build, and we have people on the ground prepared to accomplish that end.
How large of an area is the location of your facility?
So the hospital is a 14-bed hospital. They have a obstetric clinic, a dental clinic, a pharmacy, and then they have an outpatient clinic on the campus. There's a laboratory, an operating room, a morgue, unfortunately, a morgue, and then there's housing for the physicians, 2 physicians. When we first came there was 1 doctor, 1 pharmacist. Now there's 4 doctors and a pharmacist and more than ample staff of nursing and support staff on the campus. The campus covers about 7 acres. The community is a small rural community. It sits as a bedroom community of Bukoba, which sits in the northwest corner of Tanzania on Lake Victoria in the state of Karenga. The population that the hospital serves is about 30,000. And then the Bukoba is one of the larger communities in Tanzania itself, and its population is about 55, 60,000.
It's a nice size. I wondered, just how large of an area that you were actually committed to. And that's pretty good little size that you're working with, yeah. How often do you all get to go there and experience, or do you do any of the training yourself of some of the volunteers?
Excellent question. So as you're aware, we are a multi-pronged organization. We do education, not only for our volunteers, but we also do education seminars for medical staff, residents, medical students in nursing. This past summer, we did a one-day seminar, which was a 6-hour seminar that included internal medicine, primary care, obstetrics, as well as dentistry. And we've done those seminars serially over a number of years. Currently, our CEO is actually in Tanzania as we speak, meeting on the ground with folks in Dar es Salaam as well as in Bukoba. And hopefully they'll meet with the folks with the Rotary in Bukoba over the next couple of days. We have some other ongoing projects that we're invested in that need some on-the-ground attention, hence their travel there. But as a group, the bulk of our volunteers travel in the summer months, and we usually go for a 2-week to 3-week block, sometimes longer. It depends on the ongoing projects that we have invested in.
Talk about a specific moment or an experience that has probably occurred recently to reinforce your commitment to this mission program and its importance.
Wow. Okay. Well, there's countless. So the founder of our organization is 91 years old, and many people might think of a 91-year-old as someone whose son is setting, and their investment in the day-to-day activities of the things that they've been interested in will have waned. But Dr. Williams was front and center on our last trip to Tanzania. He, with our 2-day health clinic, he was fully invested as a practicing physician, seeing patients, and spent the entire day. He probably saw 100 kids over a 2-day time frame. And with that, he recognized a number of diseases that otherwise had gone untreated. He identified 3 children with cancers, one with a Burkitt's lymphoma, and 2 with, one with renal cell carcinoma, and another one with what looked to be a lung lesion. So these efforts speaks to, one, the necessity of me as an individual to maintain my attentiveness and activeness in healthcare, and 2, that we all have something to contribute, and our contribution to the human family can span a lifetime.
Absolutely. Oh my goodness, you just made me again want to jump on a plane and try to go and maybe do something with your seminars. I don't have a medical background, but I know I can contribute something. Well, we want to thank you for taking the time to talk about Project Ahead. It's been a pleasure to hear about it, and hopefully our community here If they're interested, they could go to your website and learn more about what you do, or even contact you through the website. I hope that word spreads among our audience that you're looking for a partner here in the States, and
Sure.
maybe even 7610. We would just
Sure.
love to have
our
that.
website is www.aheadincorporated.org. That's www.aheadinc.org. And not only do we have the interest in doing solar, but there's a number of other projects that we're actively involved in. And we're a growing organization. Even though we're a mom and pop organization, we're extending our tentacles into the local community in Maruku. And as that stands, we're going to grow into other communities once we feel like our efforts in Maruku have been fulfilled.
All righty. Well, thank you for joining us today. And we're going to bring you back to hear more about some updates. Okay?
By all means, I'll be happy to join you.
For the Rotary Times program, I am your host, Rotarian Dr. Deborah Jackson from the Rotary Club of McLean, Virginia. You're welcome to join us at a Rotary Club in your area for either breakfast, lunch, dinner, or service project. You can find a club near you by looking us up on the internet. Many clubs are hosting meetings in person or virtually or in some hybrid format. You only need to look us up for details. Remember, and remember always, our time is your time and is time well spent. Please join us for our next program as we continue to celebrate Rotary's 117 years of service above self.